As per the WHO guidelines, the C-sec of a country should be somewhere between 10 to 15%. But in India, the rate of caesarian or C-sec is 17.2. Yes, much more than the recommended number. So in the next 5 minutes, let's go into the depth of it and see why these numbers are so high in India and what we can do as a citizen to control these increasing number. So I believe that there are three reasons to this statistics. The first one, they are the chosen caesarean. Now, what is chosen caesarean? These chosen caesarean are the ones wherein the family or the mother herself decides to go in for caesarean birth rather than a normal one. And why would she do that? Maybe because they have chosen some auspicious day, or she just doesn't want to go in through that pain of a normal delivery. Means her pain threshold somewhere is less. I remember exactly 10 years back in 2011 when I was admitted to the hospital for my second delivery. I shared a room with this lady who wanted to deliver the baby that day because it was Lohri, an auspicious day. And that's when she told me that since she belongs to a business class family, this child, if born on that day, would be good for their business. I never thought on those aspects ever. But yes, there are chosen deliveries. Now, when these statistics are made, they don't mention that it was the demand of the family to go in for C-sec. So these are the chosen ones. The second one, which is the target caesarean. Now, what is target caesarean? Now, if we see in government hospitals, if the doctors have time and if the conditions are fine, the case is generally a normal one. But in the private hospitals, which are run by corporates, the management is all corporate held. There, they set in some target for the doctors. Because I have read some articles of the senior doctors who quit their job to start their own practice because they somewhere found it against the ethics to ask the patient to go in for C-sec when it was a normal delivery. Yes, I read some articles. So it somewhere reflects that if you are an experienced doctor, you might choose because you have a name for yourself. You can go in for private practice. But what about those young doctors? They fall prey to this target system. And then these are targeted C-sec. And the last one. The last category is the quack category. So there are some people who are not fully qualified for that job are doing that job. Now, who's to be blamed in that case? Not the doctors, because the good, real doctors, the frontline warriors who proved their grit in this COVID times, we can't blame them for this, for these quacks who are spoiling. So the problem here is the rules and regulations that govern. There aren't stringent rules to control these quacks or medical negligence. So when we talk about these cesarean birth, there are a lot of different factors. So putting the blame on the doctors who are doing their best to give back to the society, this is perfectly wrong. This is definitely wrong, and we shouldn't be doing that. I somewhere feel that there should be stringent rules and regulations for this. All the C-sec should be medically justified, only then they can go for it. Otherwise, there will be huge penalty, both to the family, if family is asking for it, or to the doctor who's performing. And how do we decide that? The government can create a third-party audit with some senior doctors in the panel who can go through these cases. Because let's face it, we live in a society wherein if we are not asked for 5, then we'll not wear our helmets. So we wear our helmet because we fear the fine. We wear our mask because we fear the fine. So till the time you have these stringent rules and regulations in place, people are not going to follow the rules. And these heavy fines will be a deterrent towards these soaring number of CSEC. So towards the end, I would just like to say, blaming the doctors is not done. They have proved themselves. The fraternity stood to serve the community in these times. So this is my perspective on caesarean. What do you feel about it? Do share in the comment section. On this note, this is your friend Garima signing off for now. See you in the next video.